Hello and welcome to Mental Health Basics. My name's Nicole Perry, and you're watching the first of 6 workshops I'll be presenting in collaboration with the United Cultures of Canada Association. This workshop was developed for the UCCA under the project Promoting Newcomer Mental Health Through Education and Community Service. We'd like to acknowledge the gracious support of family and community support services for this project. I'd also like to respectfully acknowledge that I'm recording this workshop on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. And just a little disclaimer before we begin. This workshop has been developed for educational purposes and is not intended to be a substitute for professional advice. So as I said, my name's Nicole Perry. My pronouns are she and her, and I'm a registered psychologist specializing in shame resilience, healing trauma, and setting boundaries. I work out of a private practice in Edmonton, and my work with clients is collaborative and feminist at its heart. This means I really try to see what people are struggling with within the context that they're living or have grown up with, to better understand their struggles. It also means that I don't see mental health as individual failings or weaknesses, but rather understandable and very human reactions to life's events and circumstances. In this way, I try to approach healing with warmth and curiosity and offer a safe container for working with difficult experiences. Now, just so you know a little bit more about who I am and where I'm coming from, I can say that I have a background in frontline work. From starting at the distress line to working at various shelters and sexual assault centers, this has also shaped how I practice and work. For this presentation, I'd like to offer a few guidelines to help us best work together. The first really has to do with consent. And what I mean by that is throughout this presentation, I'm going to be offering some reflection questions and ideas for further exploration. But I really want to leave it up to you to decide how much you'd like to engage with those questions. And to know that if I am suggesting something, it's also up to you to decide whether that suggestion is a good fit for your life. In this way, I'm inviting you to use discernment and to trust yourself. Because of course, any suggestions and information presented here by me are not meant to override your intuition, your self-knowledge, or your knowledge of your own communities. Another guideline I can offer is around comfort. As you settle into listening here today, please allow yourself to be as comfortable physically and emotionally as possible, knowing that you can pause this recording at any time and come back to it, particularly if this or any of the other videos touch home or bring up any difficult emotions for you. Okay. So our first workshop here is focused on mental health, and we wanted to do this before diving into particular mental health topics like anxiety, depression, or trauma to first understand, well, what do we even mean by mental health? So to begin, I'm going to invite each of you to take a moment, pause, and write down whatever comes to mind when you hear the question, what does mental health mean to you? From my perspective, I see mental health as encompassing emotional, behavioral, social, and cognitive well-being. So it's not just mental. It's a part of our overall health. which personally I like this frame because it means we treat it in the same way that we would treat any other aspect of our health. In other words, it's just as important as those other pieces. And in fact, we don't wait until things are going wrong with our mental health before we treat it, right? Just as the same way that we would take care of our physical well-being through healthy foods and movement, we take care of our mental health proactively as well. In this way, I've always liked the metaphor of thinking of your mental health like how you would take in your car for a tune-up and maintenance, that when we do things for our mental health, like talk with others, take care of our well-being and whatnot, that this is a way of having that healthy car that's going to be able to drive us around and take us where we need to go. Many people see mental health as well as a resource for reaching our full potential. When it's taken care of, it allows us to go many places. And of course, mental health, we're not just talking about the absence of mental illness. We're also talking about the presence of resilience, coping skills, flexibility, and balance. Here, I'd like to add that physical, mental, and spiritual health are interconnected. That means that what's happening with one impacts the others. So, for example, if a person is depressed, they would be actually at increased risk of physical health issues like cardiovascular disease. When dealing with physical illness or pain, on the other side, that of course impacts our emotional well-being. These things do not exist in isolation, and yet another reason for us to take care of it. I also like to say that psychological health is influenced by many things. For example, our income, our education, our genetics, our culture and gender, the health services that are available to us, as well as current life circumstances. And so with that in mind, this means that our mental health can change over time. Someone who is currently struggling is not locked into struggling for life. And likewise, someone who has always had a good mental health may suffer at a certain moment in their life due to life circumstances and other events. Again, this is not about us as having individual weaknesses or failings, but recognize that just like our physical health, our mental health can be impacted by what's happening around us. And this is very well put in a video about newcomers in Canada that unfortunately I can't play for you through this recording, but I will link it, and I encourage you to watch the whole thing. For now, I would like to share this quote from that video that I think really highlights the relationship between coming to Canada and mental health. Okay, so the speaker says, "The past studies show that immigrants generally arrive in Canada with a better mental health than Canadians, but it declines very quickly in a short period of time in Canada. So why is that so? Why is mental health taking such a big toll amongst the newcomers when they reportedly should be overjoyed with moving to such a great multicultural country like Canada? So, of course, we know that the process of immigration itself can be very stressful, but there could be added stress and other factors like unemployment, separation from family, discrimination, prejudice, language barriers, lack of social support, and many other things. However, we find that the biggest influence on immigrants' mental health is related to family. Without that family support, the social support in their daily, day-to-day life, the immigrants and the newcomers, they become very, very lonely, and it gets very scary for them to adapt to the changes in their lives, and therefore they are likely to get a high level of stress." Okay, and again, I highly recommend that you watch the rest of this, but I liked that perspective. I thought that gives important context. So now that we understand a little bit more about mental health and what impacts it, Why take care of it? Well, some of the benefits of taking care of our mental health include improvements in our mood, our relationships, our ability to cope with difficult life events and circumstances. People who come to counseling or take care of their mental health in other ways also report a better quality of life, and that they're able to be more productive and able to focus at work as well. Now, so far I've presented a lot of my view around mental health. And once again, I really want to take some time to invite each of you as listeners to ask yourself, well, what's your view of mental health? And what's more, what are some of the things that might have impacted or influenced your current views of mental health? With this, I'd like to introduce you to a framework that was originally created by Pamela Hayes. That's called the Addressing Framework, for looking at the different biases that we have that may have shaped our view of certain things like mental health. So, for example, with age and generational influence, I as a millennial have many peers who are comfortable with reaching out for mental health and talking about mental health issues, though this would not be the same for my parents' generation, where it might be more stigmatized even here in Canada. And then the generations after me, of course, the people in their 20s and teens, it seems that even more common than not to be accessing mental health support and talking about mental health. So there's quite an acceptance, discussion, and openness to mental health in the younger generations. For disability or disability acquired later in life, for my own self, this would probably include my experience dealing with chronic pain issues, and helped me to understand how my own experience has helped me to understand how physical and emotional health is related. For religion, for me, that would be about growing up Protestant, which really has the belief system of hard work ethic. Suffering a little bit is in there, and that's influenced me for sure. Now, ethnic and racial identity, I'm a white settler. But here I was thinking of other scenarios where I've seen, for example, people in the Black community. And we know that help-seeking behavior in this community is often affected by mistrust of the medical model. And so many Black Canadians often begin with faith-based outreach instead. Skipping through a little bit, of course, you can look at your own religion, ethnic and racial identity, socioeconomic status, sexual orientation, and Indigenous heritage, as well as national origin. And the last one I wanted to touch on here was gender. Many men in our culture, in Canadian culture, have been taught to toughen up, to push their emotions aside in order to move toward action instead. And so they may have limited access to their own emotions or to the ability to express those emotions. In fact, many men I work with, the only emotion they were ever allowed to express was anger. But that's not the same thing as not having those other emotions, such as sadness, shame, and disappointment. In fact, we can see this because men in Canada have higher rates of death by suicide. So once again, I'm just asking you to take some time to reflect on your own biases and messages that you may have received from your culture, because of your age, and different groups that you might be part of. You may ask yourself, how does your current social context, as well as your family background, shape your biases? And to think about your own social circles of influence and how accepting or not accepting they are of mental health. Now, the reality is, whatever our view on mental health, we know that mental illness in Canada is quite common. About 1 in 3 Canadians will be affected by a mental illness at some point during their lifetime. So it's very likely that most of you watching this will have come into contact with someone who is struggling with their mental health. Now, this is just the top of an infographic provided by the Government of Canada that I'll make sure to link in the resources, but there are a couple parts of it that I wanted to highlight. One being the prevalence of mental health issues, and the second one to note that early care and seeking treatment can help individuals recover from or manage a mental illness. However, stigma and other barriers can delay people from seeking help. I share this because I know many of you as community leaders will be the first point of contact for folks in the community who are struggling with mental health issue. So whatever we can do to hear that person, try to understand their struggle, and reduce stigma may allow them to take further steps to support their own mental health. Okay, so what to do when someone has identified that they have a mental health issue or could use some support with their mental health? Well, there's several different types of health available. One would be going to their family doctor. This would be someone who has a medical degree and may be able to treat with medication certain issues like anxiety or depression. If the person's family doctor is not able to or not comfortable with providing medication for the mental health issue, usually the next step is to see a psychiatrist. In order to see a psychiatrist here, you would need a referral from the family doctor or from a psychologist. And that psychiatrist is also a medical doctor, but they have a specialization in treating and diagnosing mental health, as well as working with those particular types of medications. Okay, so those are more around pharmaceutical care. Then we move on to regulated counselors, such as psychologists, social workers, and Canadian clinical counselors. And just to give you an idea, each of these is a little different from each other, but with regulated counselors like that, and specifically I'll talk about psychologists, this would mean someone who has either a master's degree, a Ph.D., or a Psy.D. in the field of psychology. So that's the study of understanding human behavior, treating mental health issues. They typically also undergo a process of being supervised for 2 to 5 years before completing ethics and knowledge exams in order to be fully registered. Psychologists and social workers and counselors can do counseling and evidence-based therapy, provide treatment for mental health and other health-related issues. And some psychologists also perform psychological testing and diagnoses. Psychologists and other regulated counselors cannot prescribe medications for a mental health issue. They can work with your doctor or psychiatrist, but they cannot themselves prescribe. Now, some of you may have come into contact with what we call non-regulated counselors. These individuals may have a wide variety of backgrounds and education. They may call themselves something like a counselor or therapist. But what I often encourage people to keep in mind is that where regulated counselors, they have a protected title. Only certain people can call themselves psychologists or social workers, and that means there are minimum standards that need to be met in order for that person to practice. Second, if you ever have a concern or something goes wrong with the therapist you're seeing, if you see a regulated counselor, you would have a regulatory body you can turn to with a formal or informal complaint about that person. Now, working with a regulated counselor doesn't guarantee a better relationship, but it does help protect against exploitation. Someone who is non-regulated and maybe calling themselves a counselor, a therapist, or life coach, those are not protected titles. So it means that some people calling themselves that may have a lot of background, education, and experience in the area, and others may not. So hopefully that makes sense. And of course, I will be here for those of you attending the live workshops to answer any questions you might have about what I've gone over. I also wanted to share some of the common therapeutic approaches. Now, a psychologist or therapist, their job is to use effective strategies supported by the research to help work with you to address problems or concerns that impact your well-being. The goal is to help you feel well and to give you the skills to manage current and future problems in a healthy and helpful way. But what I wanted to highlight here is that there's many different types of therapy available. Some folks, when they think about therapy, they think, oh, it's just a place where you talk about your problems. And that is not necessarily the case. There are some approaches that do focus more on thoughts, such as cognitive behavioral therapy or CBT, where their belief is that you can change thoughts and behaviors in order to improve mood, and they work specifically with clients on those changes. There's also places like acceptance and commitment therapy or ACT that work more on, this is a modality, not a place, but they work on accepting difficult feelings with compassion. Then there's dialectic behavior therapy or DBT, which teaches clients to manage strong emotions, tolerate distress, and build relationships, healthy relationships. Mindfulness-based therapies may be practiced alongside other therapies and typically involve in observing your experiences without judgment and learning to tolerate the discomfort of any of those experiences. Then there are somatic-based therapies or body-based therapies, often used to treat trauma, but may be used for other issues as well. Common ones include EMDR, which stands for eye movement desensitization and reprocessing, and somatic experiencing. And for those of you who have questions about the differences between those, I'm happy to answer them. But the basic idea is believing that trauma is stored not just in our minds, but also in our bodies, and helping clients to slowly and safely process through any of those traumatic events or difficult issues that might be stuck inside our bodies. Now, there's many more therapies, many more that I could possibly go over today, but this is just to give you an idea that there is so much out there. And of course, many psychologists and other therapists are trained in multiple modalities. And so if you or the person that you're supporting tries out one therapeutic approach and it ends up not being the right fit, you may be able to ask that therapist to try something else. Okay, so assuming that the person is able to find a therapist they like and an approach they like, what would be some of the benefits we see in counseling? Well, first I'll ask you that question. If you know someone who has access counseling or you yourself have, what did you see as the benefits? Personally, I see it as a space to explore your feelings, thoughts, experiences, or issues that are going on in your day-to-day life. As you explore these issues, feeling listened to and validated. And when people feel heard and understood, they're often empowered to take more control in their life over the things that they do have control over, while letting things go or accepting the things that they don't. Counseling can help identify our strengths, our inner resources, and our choices. In addition, it can help people move toward realistic personal goals or even set these goals to begin with. It assists with the healing of emotional effects of adverse experiences or trauma. Many clients talk about the valuable awareness of themselves and understanding of the world that they gain through counseling. And as they do so, they develop strategies to enjoy life, have fulfilling relationships, and become more resilient to problems that arise in everyday life. Now, how do you find a therapist? Well, you may be able to go through your family doctor and either get a recommendation through them, or some doctors have a psychologist or therapist who works within the clinic. Others appreciate having a personal recommendation, someone who knows them and could say, and also knows a therapist that they think would be a good match in terms of personality. Now, I know many of you may be meeting folks who are still dealing with the stigma of mental health and so may not feel comfortable reaching out to family or friends. And so if you're here in Alberta, there's also the Psychologist Association of Alberta, or the PAA referral line, where clients can call, give a couple parameters about what they're looking for, like a certain language or cultural backgrounds, this sort of thing, and then get some 3 suggestions for a psychologist who might fit those criteria. As well, there's online listings such as Psychology Today or Inclusive Therapists, where people can look online to try to find a good match for themselves. Now, these last 2 that I talked about are primarily for someone who would be seeking counseling in a private practice setting. And in these settings, you're more likely to be paying full rate for the service, which of course is fine for some people if they have insurance like Blue Cross or Sun Life. For others, they may be looking for low cost, no cost services. And for that, your best bet would be a nonprofit agency. Here in Edmonton, that might include the Family Centre, the YWCA, or of course, the United Cultures of Canada Association has a program as well. And these all have varying wait lists, so best to reach out to them directly to find out. Next, we have questions you can ask a therapist. So once you find someone who you think you can work with, you can ask these questions either within that first session, or some therapists will provide a free 10 to 15 minute phone consultation to ensure it's a good fit. So you might ask them, what's your training, your area of expertise, and your experience, to help ensure that they have experience with the issue you're coming to counseling with. You want to make sure that they are licensed to provide psychotherapy, and specifically that they're licensed for the area in which you live. Many people don't realize that, for example, my license as a psychologist licenses me to practice within Alberta for residents of Alberta. This means I cannot work with someone who lives in Ontario because my license doesn't cover it. So with telehealth being so popular these days, it's important to make sure that your provider is licensed for your area. You would also want to ask them, what kind of therapeutic approach do you use, right? If there's something in particular that you're drawn to, if that might be something that they would utilize. You can ask, what can I expect from treatment? For example, are there any risks of this treatment approach? How often should I be coming? What would sessions look like, and how long can I expect to see you? And of course, what is the cost involved? Now, once you meet with that therapist, or the person meets with the therapist, they may want to ask themselves some reflection questions. For example, do I feel listened to, respected, and comfortable? We know that the therapeutic alliance, or the relationship that the person forms with the therapist, is really the most important factor for healing. You might also want to ask, do I understand what's expected from me? For example, do the expectations, involve homework in between sessions or preparing certain things in advance? And if so, are these expectations realistic for me at this time? Finally, I would add, do I feel hopeful about the treatment plan? I know I always want people to leave my office, even if the emotions that were brought up were difficult, feeling like, yes, there are things we can do to alleviate any of that suffering. We're going to be working on that together. and that there's hope for feeling differently down the road. Now, if you meet with someone and at any point you feel like it's not a good fit, it's okay to be upfront with your therapist and let them know, either asking them to change their approach or to let them know that you plan to see someone else. We understand that this isn't necessarily personal. It's really about finding the right fit. So overall today, I hope to give you some ideas for navigating and understanding the mental health system, because I know it can be challenging to understand for newcomers as well as those of us who have lived here our whole lives all the same. Unless you're already familiar with the mental health system, it's not always easy to know where to begin. So for those of you who are attending the live sessions, please bring your reflections and your thoughts. For those of you just watching these videos after the fact, I thank you for your time and appreciate what you've given to yourself to take the time to do this and spend some time on your own mental health. In the attached PDFs, you'll see the references for the material that I was discussing today, as well as links to further resources. I hope that these will support you in your journey.